Tyler Kowalczyk Foundation presents ADHD Angels, documenting the children's lives stolen by ADHD medications. This is the story of Matthew Smith. Matthew Smith liked riding his bike, playing softball, and had a particular passion for building forts. According to his father, Mr. Lawrence Smith, the trouble all started for Matthew in the first grade, when the school social worker kept calling us in for meetings, complaining that Matthew was fidgeting and easily distracted. They were told Matthew had ADHD. The social worker told my wife and I that if we wouldn't consider drugging our son, we could be charged for neglecting his educational and emotional needs. Matthew Smith took Ritalin from the age of 6 to the day he died at age 14. He said, "I don't want to take it. It makes me feel stoned," Matthew's father, Larry Smith, said. He took it because we told him he needed to take it. Smith and his wife Kelly told CBS News that their son's general health was fine. Matthew was a healthy, very active 14-year-old. No one would suspect he had any problems, said Mrs. Smith. On March 21, 2000, while skateboarding, Matthew died suddenly from a heart attack. He was 14 years old. The coroner determined that Matthew's heart showed clear signs of the small blood vessel damage caused by stimulant drugs like amphetamines, and concluded that he had died from the long-term use of the prescribed stimulant. "If we hadn't have been pressured by the school system, Matthew would still be alive today," says Mr. Smith. "I cannot go back and change things for us at this point. However, I hope to God my story and information will reach the hearts and minds of many families so they can make an educated decision." The Smiths offered advice to parents whose children might be on Ritalin. "Hopefully you can find an alternative of therapy for your child. I hope teachers can hear this. And if you have a child with ADD or ADHD, there needs to be more responsibility. Give them a big hug and tell them it's going to be all right," said Mrs. Smith. If you have a child that's on Ritalin, consider taking him to a pediatric cardiologist to have extensive testing done to make sure there's no damage you know. I'd hate to have what happened to our family to happen to anybody else's child or family, added Mr. Smith. Unfortunately, this child is not alone. These medications are currently hurting and killing children all over the world. The truth is, no one actually knows how many children's lives have been taken, due to the deaths most often being reported as occurring from natural causes, as it is almost impossible to prove the medication was the sole contributing factor. The end result, however, is still the same. The child is gone. The family is broken and left with so many unanswered questions. We here at Tyler Kowalczyk Foundation implore you to find holistic, safe alternatives, and do not give up until you find the one that works for your children. Warning: please never stop any psychotropic medication without first consulting your child's doctor, and allow them to closely monitor the detoxification, as cutting these medications suddenly can lead to severe harm or death.